Hello, and welcome to the Clinical Liver Disease video series. CLD is an official digital learning publication of the AASLD. I am Dr. Howard Tzu-Hao Lee, the transplant hepatologist and assistant professor of medicine and surgery in Baylor College of Medicine. I'm the author of the How to Manage Metabolic Syndrome in Post-Transplant Liver Transplant Patient in CLD. I'm here with my co-author, Dr. Apaar Dadlani, transplant hepatology fellow at Baylor College of Medicine, Houston, Texas. Today, we'd like to share with you how to manage post-liver transplant metabolic syndrome. Metabolic syndrome, characterized by obesity, dyslipidemia, diabetes, and hypertension, affects over half of the liver transplant recipient within 3 years post-transplant. It leads to various complications, including cardiovascular and renal complication, and graft statosis as well. Monitoring and management of post-liver transplant metabolic syndrome is crucial in current area, given the rising NASH cases and the longer survival of liver transplant recipients.
We will first talk about dyslipidemia. Dyslipidemia, a leading cause of cardiovascular morbidity and mortality, affects up to 60% of the liver transplant recipients, mainly due to immunosuppressive medications such as calcineurin inhibitors, mTOR inhibitors, and glucocorticoids. The AASLD and American Society of Transplantation recommend annual screening with a lipid panel, starting intervention if LDL is above 100 milligrams of deciliter, and statin therapy if necessary. Careful monitoring is essential to avoid drug-drug interactions between statins and calcineurin inhibitors.
Next, we're going to talk about diabetes. Around 15% of the liver transplant recipient develop new onset diabetes, with 1/3 having pre-existing diabetes before liver transplant. Poorly controlled diabetes increase long-term mortality in post-liver transplant patients. Main risk factor of diabetes, including steroid use, calcineurin inhibitor use with tacrolimus with the highest risk, and some other metabolic syndrome factors such as obesity. Guidelines recommend monitoring blood glucose every 3 months in the first year post-liver transplant and then annually afterwards. Lifestyle and pharmacological therapy should be used if diabetes was diagnosed to target A1C less than 7.0. Insulin is the preferred agent during the immediate post-operative phase. After that, oral hypoglycemic agent can be used with a careful monitoring renal function given the possible complications.
Now we will talk about hypertension. Up to 75% of liver transplant recipients develop hypertension, increasing the risk of cardiovascular and renal complications. Calcineurin inhibitors cause increased renal vasoconstriction and sodium retention, leading to elevated blood pressure. The target blood pressure in post-transplant recipients is less than 130/80 millimeters of mercury. Lifestyle modification is the first-line management, followed by calcium channel blockers, ACE inhibitors, angiotensin receptor blockers, or renin inhibitors. Beta blockers are the second-line option. Up to 30% of patients may need more than one medication, and home measurement of blood pressure is highly encouraged in these patients.
Lastly, we're going to talk about weight gain and obesity. Weight gain after liver transplant is common due to the improved health, reversal of catabolic state, and immunosuppressive medication post-liver transplant. Treatment including lifestyle modification, tapering steroid dose, switching the immunosuppressive medication, and some other approach such as bariatric surgery if needed. Among all the possible bariatric surgery options, sleeve gastrectomy is the preferred method. GLP-1 receptor agonists are also a potential option, pharmacological options for obesity. However, we need more data specifically in the post-liver transplant recipient.
So in summary, liver transplant recipients are at high risk of developing metabolic syndrome due to pre-existing conditions and post-transplant medications. Early intervention with lifestyle modification and pharmacological therapy is crucial to prevent long-term complications. Immunosuppressive side effects and drug interactions must be considered when managing metabolic syndrome. A multidisciplinary approach is necessary to monitor and manage the syndrome. On behalf of all of us on the CLD team, I hope you found this brief review useful. For more information about management of metabolic syndrome after liver transplant, please visit us at www.cldlearning.com. Thank you for watching.